Simeon Schindelman is CEO, Brighton Health Plan Solutions, and he is with us today to talk about some big picture opportunities and challenges in the healthcare world. Good to see you, Simeon.
Appreciate being here, Steve.
Tell us what the organization really is.
Brighton Health Plan Solutions is a part of a business called Brighton Health Group. Brighton Health Group came out of the idea that if you combined the care delivery, we have a business next to mine that has to do with helping physicians deliver care. Combine that with health plan, kind of health care, health insurance, that the two working together, some collaboration would teach us about how health insurance and the delivery of care can both be improved. That's Brighton Health Group, and we're part of that in the health plan operations.
And two brands that would be, well, one particular, MagnaCare, a part of it?
MagnaCare is the biggest part of Brighton Health Plan Solutions, and it's one that's successful. It's been around for 25 years, well known across New York and New Jersey.
And Create is?
Create is a new venture for us. So we have the idea that we're moving into the commercial market. MagnaCare has historically been very successful and a major player in labor business, Taft-Hartley funds, union-oriented business. And we have some commercial business, traditional employers, but not as much as we think we'd like to have and should have. And so we're using a new platform, which we're building or finishing the building of right now, to enter the commercial market with Create.
Talk about this. You said that changes are being made, leading changes, that will be, quote, good for everybody. Make that case.
Well, part of the way that we look at this business is that supporting improvements in the world of healthcare require us to align the interests of every key player. We think our competition doesn't do that very well. We think there's an opening for us. So we think very hard about a variety of players in healthcare. The people who deliver care, doctors, hospitals, nurses, physician extenders. There's a world of people who deliver care. They're the people that receive care. We worry a great deal about them and their families, which I always want to be thinking about emphasizing. It's not only the person who needs care, it's the people around that person. It is health plans, businesses like ours. It's plan sponsors, an employer, a labor fund. They're also in this. And it's also agents and brokers and consultants who advise folks about what to do. It's even regulators. We work hard.
Government.
Absolutely. Government's a big player everywhere. They're a big player in healthcare. Let's recognize that and work with.
But here's the interesting thing to me as you lay that out. Everyone can win in this, as you're describing it, but devil's advocate. What happens when the goals of some of those entities conflict, you say?
Well, there are then the folks who maybe aren't willing to share the kind of goals that help each of the other players, maybe are folks who won't be participating in what we want to do. So when we think about Create at our company, and the reason we're building a brand new business platform for this is because we have some very specific ideas about how we can align interests. And the reality is some players, maybe there's some advisors, maybe some doctors or hospitals or plan sponsors won't feel good about that. But the ones who want to participate recognize that it's in their best interests to help other stakeholders. Those are the kind of partners that we'll have, and we're building that coalition already.
Does healthcare have to be as confusing as it sometimes seems to most of us?
There's no question it doesn't have to be. In fact, that's something that we're addressing, and I'd love to give you just a brief window into how we think about that.
Go ahead.
One of the core ideas or core observations that went into our design of the product we call Create, and that you'll hear about in the media and other ways soon, is that people tend to access care across a wide array of providers of care. So they may see many different physicians. Those physicians may be affiliated with many different hospitals or physician groups. And one of the very simple concepts that we started to learn about is that when we can have people seek care from a narrower range of providers, instead of going, my family goes to that hospital for one service, that other one unaffiliated for another service, if we can narrow that a little bit, that actually can reduce some confusion. Why is that? That's because the better clinical relationship I have with a doctor, with a hospital, the more that clinician, that office will know about me, the more data they'll have about me, the more they understand my personal preferences, the preferences of my family. That can help not only in how care is delivered, but it can also help in how I understand how to access healthcare and how to use my health insurance as well. Probably a little bit of a nuanced story in there, but the greater and deeper we can make the personal relationship I have with the people who provide care to me, meaning convincing me to see, frankly, a narrower range of care providers, that'll help in how well I understand what I need to do.
You and I are having a conversation recently over in New York in your offices about big picture healthcare issues, and one of the things that struck me was the need for consumers to get better educated themselves. It's important, isn't it?
Very important. Part of what we do, we think a real lot about that. Very few people access the healthcare system frequently, but many people do. Just we don't all do it regularly, so we have to relearn each time. Part of what we're building, in fact, in our Create platform are tools that are very specific about educating folks about the choices they can make, the power they have, and the strength they have in their own decisions.
So let me try this. Talked about competition.
Well, competition for us is very, very major players. There are big players here in New Jersey and across the river in New York as well, and they're not successful without a reason for their success. So we've got to work very hard to be a new entrant in a difficult business and be able to actually win and be successful.
So when you see certain players, you're in a different arena, but certain players drop out of certain markets in New Jersey, does that, you say to yourself, wow, geez, do you see that as an opportunity?
Absolutely. For us, it typically would be an opportunity when somebody drops out. We have a team that is deep into health insurance. People like me, I've been in this business for 31 years. And I'm one of those people who really actually enjoys it. I enjoy trying to pull the string on this business and try to figure out how to make it better and more effective. When others can't or won't, that's simply space we can fill. And we like that.
So you see the creative, dare I use that term again, you see the creative possibilities here where someone might just say, it's a bottom line business, it's a numbers business, you say?
Well, certainly there is a business here. So I'm not going to deny that many players, us included, are in this as a business. But that doesn't mean that we can't be helping others be more successful at the same time. So we do believe there's a significant opportunity and a significant opening for not only better collaboration, but much more consistent, much more broad collaboration where we're taking into account the interests of the other players.
Last question. One of the topics we talked about offline was leadership. We're both fascinated by it. The number one lesson you have learned about leadership in your career would be, put you on the spot.
The number one lesson is a combination of two factors, listening and learning. And it sounds trite, it may sound like an old story, but I'm not a young man anymore, and I'm learning every single day. And I'm doing it because I work hard on listening. I'm not as good at listening as I need to be, and I'm not as good as I'm going to be tomorrow. But the better I can listen, and the more I'm going to learn. And again, sounds trite, sounds like I read it in an old book, and I probably did, but it should be in every new book as well.
And real quick, 20 seconds. Someone says, I have the answers. You say?
I say, I'm big on the idea of trust but verify. If you have the answers, I'm going to listen to you, but I'm going to ask you a lot of questions.
Simeon Schindelman is CEO, Brighton Health Plan Solutions, Magna Care Create. And I want to thank you for joining us, and we appreciate it. We learned a lot. Thank you so much. Thanks, Simeon.
Great to be with you.
Good stuff.
The preceding program has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence, and 13 for WNET, NJTV, and WHYY. Funding for this edition of Caucus New Jersey has been provided by Adler Aphasia Center, RWJ Barnabas Health, Seton Hall University, PSE&G, New Jersey Sharing Network, NJM, and by Josh S. Weston. Promotional support provided by NJ.com, Small News, Big News, True Jersey, and by Commerce Magazine. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. Caucus New Jersey has been produced in partnership with TriStar Studios.